Today's lesson focuses on how to properly document wounds in a forensic investigation. We will cover abrasions, contusions, puncture wounds, stab wounds, gunshot wounds, burns, and bone fractures. Our goal is to ensure documentation that is accurate, objective, reproducible, and legally defensible. In forensic work, what you document may later be used in court, so clarity and neutrality are essential. Before describing any wound, always follow these universal rules. 1. Use the SOAP structure when applicable. Subjective, what the patient reports, using their own words. Objective, what you observe, measure, and record. Assessment, your forensic interpretation within your scope. Plan, what you will do next. Referrals, imaging, evidence, collection. 2. Document, using neutral, non-speculative language. Avoid guessing mechanisms, unless supported by evidence. 3. Use anatomical precision. Describe wounds using exact location. For example, left anterior forearm, size, length times width times depth. Shape, orientation, horizontal, vertical, oblique. Color, edges, and surrounding tissue. Presence of foreign material. 4. Photograph systematically. Overall body. Regional view. Close-up with scale. Close-up without scale. Maintain chain of custody. Abrasions are superficial injuries caused by friction or scraping. Documentation points. Type, scratch, graze, imprint, brush burn, pattern. Note if it reflects an object, for example, grid, rope, pattern, color, and moisture. Fresh, dry, crusted, directionality. If visible, for example, tailing. Associated debris, dirt, gravel, fibers. Example documentation. Linear abrasion, 3 centimeters. Oblique, right cheek, dry, reddish brown, with faint patterned imprint. Contusions are blood, extravasation into tissues from blunt force. Documentation points. Size and shape, color. Avoid estimating age. Simply describe pattern. Shoe sole, belt cylindrical, object swelling, or tenderness. Location relative to bony prominences. Example, documentation, oval contusion. Yoni, CM bluish purple. Left upper arm, mild swelling, no break in skin. Puncture wounds are deep, narrow injuries caused by pointed objects. Documentation points. Number of wounds, shape, and diameter of entry depth. If measurable presence of bleeding or foreign material, whether edges are clean or irregular. Example documentation, single puncture wound, circular, 0.4 centimeters, diameter, right thigh, minimal bleeding, edges clean. Stab wounds are deeper than they are wide, caused by sharp instruments. Documentation points. Length of wound on skin surface shape. Linear, spindle-shaped, V-shaped edge characteristics. Clean, abraded, bevel directionality. Upward, downward, horizontal. If determinable number of wounds, associated features. Hilt marks. Hesitation marks, describe only. Do not label intent. Example, documentation. Linear wound, 2.5 centimeters. Clean edges, left chest. Oblique orientation. No visible hilt mark. Gunshot wounds require precise, neutral, and non-speculative documentation. Documentation points. Entrance versus exit. Describe features without assuming unless clear size and shape. Stippling or searing. Describe only. Do not label range unless trained. And certain margins. Inverted, everted, abraded directionality. If determinable number of wounds, recovered projectiles, or fragments, maintain chain of custody. Example, documentation, circular wound, Leighton, Hachi, Shiyama, abraded margin, right upper abdomen, no soot or stippling visible. Burns are documented by type, depth, and distribution. Documentation points. Type, thermal, chemical, electrical depth, superficial, partial thickness, full thickness, within scope, color and moisture pattern. Splash, contact, flame, grid, glove-like edges, sharply demarcated or irregular. Associated findings: blisters, charring, intact versus ruptured. Example, documentation. Partial thickness, burn, 6-4 centimeters, blistered, moist, irregular margins, right forearm. Fractures require clinical and radiologic correlation. Documentation points: location, bone and segment type, transverse, spiral, comminuted, impacted. If radiology available: deformity, angulation, rotation, shortening, swelling, bruising, or open wound. Mechanism: describe only if supported by evidence. Imaging: attach radiology findings. Verbatim example: documentation, closed fracture, midshaft left, ulna, mild swelling, no open wound. Confirmed by X-ray. Accurate forensic wound documentation protects the integrity of the investigation and supports both medical care and legal processes. Always remain objective, precise, trauma-informed, and evidence.